Okay, so today our class is on CPR. CPR stands for cardiopulmonary resuscitation. So what is cardiopulmonary resuscitation? Cardiopulmonary resuscitation means you are providing artificial ventilation and perfusion to the vital organs. Now, what is the need of providing artificial ventilation and perfusion to the vital organs? This we do in a patient of cardiac arrest. So what do you understand by cardiac arrest? In cardiac arrest, due to different reasons like ventricular fibrillation or ventricular asystole, pulseless electrical activity, due to myocardial ischemia, okay, so other structural heart diseases, okay, so cardiac rupture. So there is an abrupt loss of cardiac pump function. Okay, so and if this is not reversed immediately, if there is not a prompt intervention is not done, so this patient will ultimately die. This will lead to the death. Okay, so therefore we need to carry out the CPR. So what is done in CPR? CPR mainly constitutes of two things. One is your basic life support. Another is called as your advanced life support, ALS and BLS. Okay, BLS and ALS. So what do you understand by BLS? Okay, so BLS, it involves, okay, so three things. That is your, in basic life support, the first important is your immediate recognition that the patient is in cardiac arrest, that the patient has suffered a cardiac arrest. You have to first recognize it and you have to activate the ERS. I'll tell you what do you understand by activation of ERS. ERS is emergency response system. Second step of BLS is that you have to go for a early CPR, early cardiopulmonary resuscitation. And the third step is rapid defibrillation. Rapid defibrillation. These are the first three BLS links in the adult chain of survival. Okay, so these are the first three. Next in ALS, I'll discuss about after discussing about BLS. So in BLS, okay, the first thing which I told you, okay, the activation, okay, so of the ERS. So what do you understand by the activation of ERS? Activation of ERS means you have to early recognize that a cardiac arrest has occurred. Okay, so you have to early recognize that a cardiac arrest has occurred, because this recognition is very much important, because every minute the patient is in cardiac arrest, chances of survival drop by 10%. So first you have to ensure that the person, you have to recognize that the person is in cardiac arrest. How will you recognize? You have to see whether the patient is responding to you or not. You tap on the patient's shoulders and shout at the victim. If the victim is unresponsive and you find that he has absent or he has abnormal breathing, is gasping, so the rescuer must assume that the victim is in cardiac arrest. Okay, and whether the patient is trained or untrained, most important, he should activate the emergency response system. He should shout for help. He should call, okay, so the emergency team, and he should activate the ERS. Okay, and he should start the first rescuer. Okay, he should call out for help, shout out for help. And if other rescuers are also present, we tell someone to get the AED, automated external defibrillator. I'll show you this instrument also in the pictures. And then what he's going to do is that he should start the CPR immediately. Okay, and in case if the rescuer is not trained in recognizing abnormal breathing, he's not able to recognize that the person is in cardiac arrest or not. So he should phone the ERS immediately. He should call the ERS immediately, the emergency response system, once the victim rescuer finds that the victim is unresponsive. And then the person, the healthcare provider, he can guide him on phone to check for breathing. And he can also tell him, he can guide him about the steps of CPR till the healthcare provider arrives at that scene. Okay, so this is about your early activation of ERS. Then come to the steps of CPR. So in CPR, first we shall see about the circulation. So how are you going to restore the circulation? How are you going to give artificial perfusion to the vital organs? Circulation, this is mainly achieved by the chest compression. By this time, all of you must be knowing in CPR, we give chest compressions and artificial breathing. Chest compression. So which portion of the chest, where are you going to, give the chest compression? The chest compression, that is mainly given on the lower half of the sternum. So the sternum, the lower half of the sternum. Okay, so here we are mainly going to press with the heel of our hand. Okay. So what we are going to do, these compressions, when we are compressing, okay, this lower half of the sternum, it is increasing the pressure inside the thorax. It is compressing the heart. Okay, so you have got your heart here. Okay, so it is compressing the heart. See, okay, so it is compressing the heart, and it is generating the blood flow and oxygen delivery to the brain and myocardium. Okay, so effective chest compression is very important. And for chest compression, the person should be lying supine on a firm surface. So you have the rescuer, he has to place the heel of his hand in the middle of this lower half of sternum, and the heel of the other hand on top of the first hand. So that these two hands, you know, the two hands of the rescuer, that is overlapped and it is parallel to each other. And what is the rate at which the chest compression is performed? 100 to 120 compressions per minute. Okay. And what should be the compression depth? How deep you should push into? That should be around 2 to 2.4 inches. So you can write 5 to 6 centimeters. Okay, this much deep you should go. Okay. And how many breaths you have to deliver? Okay, so usually 30 compression, 100 to 120 compressions per minute, and after every 30 compressions, you have to it to be followed by 2 breaths. However, if sometimes what happens, the rescuer, he's not trained to give the mouth-to-mouth respiration, or maybe he might feel uncomfortable, or he's reluctant to give the mouth-to-mouth respiration. In that case, you can just tell the person to carry on these compressions only. This only carry on the compressions is called as hands-on CPR. Okay? So where you're only giving the compressions, you're not giving the mouth-to-mouth breathing. Okay, and suppose more than one rescuer is present, so you know, rescuers should change their roles after every 2 minutes, so that they can effectively, you know, if one is getting tired, after 2 minutes, let the second person give the compressions. So this is very important. And remember, the trained, the rescuer who feels confident that he can perform both the compressions and ventilations, so he should open the airway using a head tilt chin lift. I'll just show you the pic. First, just see this pic here, if you can see it here. See, first we are checking for the response, then we are establishing an airway, checking for breathing. If no breathing, we are giving rescue breaths. If still no signs of life, give 30 chest compression. Look at this, the way this person has placed the heel of this hand on the chest, on the sternum, and the second hand, the heel of the second hand on top of the first hand. Okay, and look here, you continue till help arrives. And adult CPR, you can see, I'll just show you this. Look at this one. Look at this, how he's lifting the chin. Can you see he's lifting the chin and he's tilting the head? You see through, he's tilting the head and he's lifting the chin. Okay, so this maneuver is called as a head tilt chin lift. Head tilt chin lift. So he should open the ones, you know, this rescuer who is confident, is a trained rescuer. So he should, you know, lift the chin and tilt the head. By this way, he can open up the airway. Can you see this is a blocked airway? You can see here this blocked airway, and by lifting the chin and tilting the head, this airway has opened up. Okay, so this is very important. A healthcare provider, he should use this head tilt chin lift to open the airway. Okay, and suppose in this victim you suspect a spinal injury, so they should use the spinal motion restriction. They should place one hand on either side of the victim's head. Okay, so one hand here, one this side, another hand that side. One hand on either side of the victim's head to stabilize. Okay, while performing, on either side to hold it still while performing the compressions. Okay, and usually you can see here this head tilt and chin lift procedure. The chin, it is moved forward with this index finger. Can you see the patient has placed this index and middle finger? Usually this index and middle finger is used to lift the chin, while the other hand that is placed over the forehead. Okay, so the other hand is placed over the forehead, and here the index and the middle finger is placed over the chin to lift the chin, and to tilt the head, the other hand is used. So this is important to maintain the airway, open airway. You have to use this chin lift, head tilt, or head tilt, chin lift maneuver. Right? So this is about the airway. I told you about the compressions. Next, let's talk about the breathing. So to provide the breathing, as I told you, the breathing has to be provided in what, frequency 30:2, 30 compressions with 2 breathing. How are you going to provide the breathing? It is called as mouth to mouth breathing. Okay, so mouth to mouth rescue breath. In this, open the victim's airway, pinch the victim's nose. Anyhow, here the pic is not there. In this, we mainly pinch the victim's nose. Okay, here the patient is just performing the opening up the airway. While giving the mouth-to-mouth breathing, we pinch the patient's nose, and we just create an airtight mouth-to-mouth seal. Okay, and we give one breath, or mouth to mouth, we give one breath over 1 second, and each rescue breath is delivered over 1 second. And remember, while giving the breath, you have to observe the chest. If the victim's chest does not rise with the first breath, then again you have to reposition the head by performing this chin lift, head tilt maneuver, and give the second rescue breath. So with this breath, you have to look at the chest. There should be a visible chest rise. Okay, so this is how you give the breaths. It's given over 1 second, mouth to mouth breathing, pinch the nose. Okay, and you observe that there should be a visible rise in the chest. And once, this is the basic BLS, how you give mouth to mouth breathing. And once your advanced airway, ALS support arrives, we give these breaths through the endotracheal tube or the laryngeal mask airway that is used in place during the CPR. Okay, where we give one breath every 6 seconds. Okay, so without attempting to synchronize breath between compressions. Once the ALS arrives, the advanced life support arrives, what do is that we insert the endotracheal tube, the endotracheal tube or the laryngeal mask airway, and we just give the breaths, one breath every 6 seconds, and the chest compression as it is carried out, We don't interrupt between the chest compression while doing the ALS. But before this ALS arrives, ALS is advanced life support. Okay, so before you get the facilities, you get the endotracheal tube and all, at least the basic life support, we can continue with this mouth to mouth breathing. Okay, and remember, there should be no pause in the chest compressions. Okay, so for the delivery of ventilations, after the advanced airway. So before the advanced airway, at least while you are giving this mouth to mouth breathing, you have to pause for 1 second in the chest compression. But ideally, once your advanced ALS arrives and you have already placed the endotracheal tube and all, so there should be one person who will be delivering the breaths, every 6 seconds, and one person who should be continuously providing the chest compressions. This is very important. Okay, next is early defibrillation. Now look at this instrument. This is an automated external defibrillator. Okay, so this is the automated external defibrillator. So defibrillator should be used as soon as it is available. So what these AED, short form we say it AED, automated external defibrillator. So this should be, once you attach, there are 2 leads. Okay, so of this one, you can see there are 2 leads. They have attached it to the chest. So what is done is that once you attach these leads, okay, so to the chest, it is able to recognize itself, it is able to analyze the cardiac rhythm, and if it feels appropriate, it is going to deliver an electric counter shock. Okay, so this operator, he is going to place these 2 electrode pads, 2 self-adhesive electrode pads onto the patient, and when advised, the AED is ready to discharge. So CPR. And what about if suppose somebody asks you, okay, when you're giving the defibrillator, what should we do? Should we continue with the chest compression, or should we, we'll do the defibrillation and we won't carry out the chest compressions? No, the chest compressions are to be carried out. Immediately following one shock, again, you have to immediately start the CPR. The CPR should be started immediately following one shock, and it should be continued for 5 cycles, 3:2 compression to ventilation ratio, before again rechecking the rhythm. Okay, so these are the 3 basic points of your basic life support, which is very important, which all of us should know. Then I'll be talking about the advanced life support. So what happens in the advanced life support? Next, let us talk about the advanced life support, ALS. Okay, so talking about the ALS, that is your advanced life support. Advanced life support, it consists of the BLS, the basic life support, plus the use of some special equipment and drugs for establishing and maintaining the effective ventilation. Okay, so here we have to use some special equipments. Here certain special equipments and drugs to maintain the effective ventilation. So what do you have under the advanced airway? What are the things which we can use? What are the special equipments which we can use under the advanced airway? So under the advanced airway, we can use the oral and nasal airways. Okay, so orotracheal, nasotracheal, endotracheal tubes. Okay, laryngeal mask airway. You can use the mask airways, or we can also perform surgical procedures like tracheostomy. Okay, so if they are not responding to these, we can also go for tracheostomy. So all these come under the endotracheal tubes. Okay, tracheostomy and laryngeal mask airway. All these things come under when we are using special equipments for maintaining the patent airway. It just comes under the advanced airway. Okay. Next, what do you understand by the advanced breathing? Advanced breathing, first you have to confirm the endotracheal tube. Just a minute. Advanced breathing. So most important is that you have to confirm the endotracheal tube using, the clinical assessment. Okay. So, and the use of a device. How are we going to assess it using the use of a device? Usually in this, we are going to use a esophageal detector device, capnograph. Okay, it's an esophageal detector device, capnograph. That is, we use the exhaled, we are going to, with the help of this capnograph, okay, so we are going to detect the exhaled carbon. It's also called as exhaled carbon dioxide detector. Okay, so how much carbon dioxide is you are exhaling out? Okay, so that is detected by this detector. Okay, so exhaled carbon dioxide detector, or you can also say it is the end tidal. So end tidal carbon dioxide capnograph. Okay, so end tidal carbon dioxide, in fact, end tidal carbon dioxide, it is the gold standard to confirm the position of this tube in the trachea. Okay, and after you confirm the position of the tube in the trachea using these measures, this end tidal carbon dioxide and exhaled carbon dioxide detector, you are going to secure the endotracheal tube using the tube holders. Okay, and or you can also use a tape or bandage to hold the tube. And then you are going to ventilate after you confirm that the endotracheal tube is inside the trachea. You are going to ventilate at a tidal volume of 6 to 7 ml per kg at a rate of 10 breaths per minute. At this rate, you are going to ventilate the patient, 10 breaths per minute, 6 to 7 ml per kg. Okay. So this is important. Next, we go for the high quality CPR. Okay, so first I talked about the advanced airway, advanced breathing, and then in the ALS, we shall talk about the high quality CPR. So high quality CPR, the basic things are the same here also, that it has the chest compression is given at the rate of 100 to 120 minutes, 120 compressions per minute, depth of 5 to 6 centimeters deep. You have to compress it, allow the chest wall to recoil in between the compressions, and minimum you try to interrupt between the chest compression. And if there are two persons who are there, okay, so at least rotate after every 2 minutes. After first 2 minutes, let this person give the chest compression. Next 2 minutes, let the other person rotate it at least every 2 minutes. Avoid excessive ventilation. And if the advanced airway is not in place, then 3:2. Okay, so 30 chest compression with 2 ventilations, 2 breathings, mouth to mouth breathing. And if the end tidal carbon dioxide, okay, so if you can measure the end tidal carbon dioxide, if the end tidal carbon dioxide is less than 10 mm, okay, so as measured by waveform capnography, then you have to improve the CPR quality. Okay, next come to the advanced circulation. Advanced circulation is that along with the CPR, you also have to establish a IV access. Okay, so you have to attach a cardiac monitor, defibrillator, assess the rhythm, defibrillation. So all these things comes under advanced circulation. So along with the ventilation, along with the chest compression, what you're giving, you have to establish a IV line. Okay, so you have to attach a cardiac monitor. Show you the pic. And see, this is the advanced life support, as I told you, the endotracheal tube. And this you can see, so a cardiac monitor, so that is attached here. So where the rhythm and everything can be recorded here. So You can see, look at this patient, there is an IV access. Okay, so IV access and the cardiac, the monitor, so that is there to monitor the rhythm and everything. And you have to attach a defibrillator, so it will assess the rhythm, and if needed it will deliver the counter electroshocks. And you have to you have to also administer certain drugs depending upon the which is appropriate for the rhythm and for the condition, because if it is tachycardia, accordingly you have to administer certain drugs. Obviously it's the patient, if it's a bradycardia, you have to appropriate for the rhythm and condition, you have to administer certain drugs. And with the advanced airway in place, okay, so if the advanced airway is already in place, then the rescuer, he can continue to provide the chest compression. There is no need of pausing in between to provide the mouth to mouth breathing, because we have already inserted that special equipments like endotracheal tube, laryngeal mask airway. Okay, so these things are already in place, so you no need to pause in between the compressions while providing the chest compressions. Okay, so usually, normally what we see is that in these patients who usually present with cardiac arrest, the basic rhythms which we normally see in these patients are usually that of ventricular fibrillation, or as I told you, asystole, pulseless electrical activity, okay, so, or others like pulseless ventricular tachycardia. So of these, we have seen that the most common which we see in these patients is ventricular tachycardia and ventricular fibrillation. And both of these, they are quite, by giving certain drugs, they are quite, you can reverse them. Okay, so rhythm checks, they are most amenable to therapy. Rhythm checks should be done only after 2 minutes of CPR, and it should not immediately follow a defibrillation attempt. Immediately after defibrillation, don't start checking for the rhythm. It might not reverse back to the normal rhythm. Just check for 2 minutes. Immediately after giving the defibrillation, don't stop giving the chest compression. Even after the defibrillation, you continue giving the chest compression. After 2 minutes, you check whether the rhythm has come to normal or not. Okay, so this is very important. This is all about your CPR. So in CPR, I told you the main things. So I told you how these are the main things which is there in CPR. These are the main things, the procedures: chest compression. Then this is your mouth to mouth breathing. You can see in step 3, mouth to mouth breathing. This is your chin lift, a head tilt procedure. This is your AED, automated external defibrillator. This is how the electrodes are attached, and the defibrillator automatically assesses the rhythms and delivers a electric counter electric shock. Advanced life support, use special equipments, endotracheal tube, or you can use, this cardiac monitor. You monitor the rhythms, and you can see we are giving this defibrillating. Okay, so defibrillation of the heart. And then, so this is all about your CPR. CPR is a very important topic. So you should know the 2 basic things of CPR, that is BLS and ALS.